Good evening, everyone. And once again, thank you so much for joining us this evening on our innovation webinars. And this is our second one this year, and we are excited to discuss a very topical issue and excited to have our speaker who's come on board today to share with us more on that topic. I want to thank everyone who's been following the webinars and participating in the webinars. And thank you for coming to share your views and thoughts and your questions that you put through. So we want to thank you for following the webinars from last year. And we have managed to engage a lot of participants in this webinar. Through these webinars, we've also come on board to our programs and participated in our programs across all the countries that we work with. So for those who are not aware of who we are, we're held by the E4Impact Foundation, and we are going to just a small presentation to just tell those who are new on the platform who we are, where you can find us, and how to get more information about our program. So I'll just share my screen. Okay, I hope that's clear. Everyone can see that. Right, so before I share, I just want to welcome Faheema, who's our speaker today. I'll introduce her after my presentation in detail. Thank you so much for joining us today, Faheema.
Thank you so much for having me.
Great. So our most important goal as E4Impact is to teach entrepreneurship and through training. So we want to train impact entrepreneurs. We're partnering across Africa to do this with partner universities in about 17 African countries who are also becoming the leaders in impact entrepreneurship. We want to train, coach a new generation of impact entrepreneurs in Africa and in the Middle East, where our programs are being run. We're very passionate about collaboration, developing partnerships, and creating platforms where B2B, B2C marketing relations can happen between companies and between organizations in Italy, Africa, and the eastern part of the world. The E4Impact Foundation benefits of joining our movement, if I can call it, is that we are passionate about creating platforms that allow investment to happen between our alumni and our students. And we have exceeded the 2.5 million in investment that has taken place. Our alumni have come out, 85% of them with an existing business. Our programs at MBA level and the certificate level take people who are at idea stage or at startup stage or at growth stage. And 87% of our alumni have increased their client base. Access to financing through institutions that we work with, venture capitalists, private business angel investors are all coming on board, interested to work with impact entrepreneurs that come out with an investable business plan and pitch deck. Our alumni can testify to having increased their turnover by 81%. And we continue to build strategic partnership through our programs. At the present moment, we have programs that are starting in Tunisia in March, that started this March, and you can contact the university, Central University of Tunis, and the contact details are right there. If you need more information, go to our chat box. In Kenya, Tangaza University, we have a program that has just started in March. You can probably just join if they haven't gone too far. Sudan, we are kicking off in May with the University of Medical Science and Technology. In Rwanda, University of Rwanda, please, in May 2022, a program is, the MBA program is kicking off there. In Zimbabwe, they've just kicked off the MBA program in February at the Catholic University of Zimbabwe. And in Mozambique, kicking off in a few days in April at the St. Thomas University of Mozambique. you can go and register for the MBA. But if you want more information, please go into our chat box and there'll be someone who will respond to you. You can find us on social media. We are on Facebook, we're Instagram. Right now we are streaming live on Facebook. We are on Twitter, and you can get more information about our programs in all those countries that we are operating in. So that's E4Impact in short. And now it's time for us to dig deep into our topic today, where we want to understand the state of healthcare. The healthcare system has been under a lot of spotlight in the last 2 years. And today, to share a little bit more on a particular topic of her passion and life-changing experience is Faheema, who is a passionate social impact entrepreneur, something we're very passionate at E4Impact, with 10 years corporate experience behind her in marketing, risk, quality management. And she will share her experience today, how becoming the CEO of the People's Alliance for Cancer Education, a nonprofit which enables cancer patients, allowing their families and the communities and the ecosystem to fight to overcome cancer. Such an important topic. But like I said, today we focus on the digital impact of the digitalization and technology, as we talk about how healthcare systems have been under a lot of strain and have been under a lot of spotlight in terms of functionality across the world due to the pandemic we've just gone through. Welcome, Faheema.
Thank you so much, Bertha, and thank you to everybody else that's joined the call.
Thank you.
Like you said, this project is very close to my heart, so I'm going to share my screen.
Okay.
And hide myself, obviously. So digital innovation, a significant breakthrough in healthcare. So I have a little of agenda. So firstly, I'd like to share my journey because, like Bertha said, I'd like people to understand that in order to get to where we need to be, we need to have all these experiences. What is digital? I think there's been a disparity in terms of what digital is. So I'd like to clarify that. Digital transformation, digital health, and then the future of digital. And then also, as part of my journey, I'd like to share a few resources that I think people would like to have and that they can go and explore after the school. Maybe I should make my screen bigger. So can everybody see that? I think my screen just froze. There we go.
Yeah, there we go. We can now. Yeah, we can see it clearly now.
Okay. So I have, like Bertha said, a risk and quality management background, but my life literally drastically transformed in 2014 when my father was diagnosed with cancer. And I have to tell the cancer journey so that you understand the impact this project actually has, and then the features we've developed along the way. So in 2014, my dad was diagnosed. In 2015, my brother-in-law was diagnosed. And at the same time, you'll see I did a risk management course through the University of Johannesburg. And having seen my dad and my brother-in-law actually go through chemo and radiation at over R1 million costs for both of their treatment. When my husband was diagnosed in 2016, I literally said to him, baby, you're going to do chemo and radiation. I'm leaving, because I had such a strong drive towards actually understanding, using the root cause analysis as to what cancer was, and then also preventative, what we could do to change our lifestyle. So he had surgery in 2016. And a year later, just through diet, lifestyle, and transformation, cancer is related to mental wellness, and something I'd like to talk about also during the later course of this presentation. A year later, we have that little baby girl. She's going to be 5 years old this year. And so Ismail is 6 years in remission. And then after all of that, we then decided to register Restore Health Group. Now, I need you to understand that this project is a passion. And so when I registered Restore Health Group, I had no entrepreneurial experience and so forth. So I went out and I went to search for some guidance and help. And so at RayScope, the very first course was called Who Am I? And we need to look at our core values. And one of my core values was how to use my my background and my training in order to make a difference. And in 2020, the People's Alliance for Cancer Education was actually born. The idea was born. And I literally sat down with people who had cancer, who's the family members of cancer, and the cancer ecosystem. I've worked with a lot of the big cancer associations. I've done sponsorship events and so forth with them. And just to understand how I could play my part within the cancer space. And so PACE is an amalgamation of all of that. And so in 2022, we were graciously afforded the opportunity to do the E4Impact course. And it was transformational. The information we received, the guidance, the mentoring has just been transformational, especially the pitch deck. It's something that not a lot of entrepreneurs understand when you're standing in front of investors. And now we actually have that insight. So what is digital? Digital can be summed up by 4 specific words, right? And these words are specifically customer-led. So what are your customers actually saying? Where are they? How are they actually using information in order to better their lives? It is data-driven. So one of my biggest issues with the cancer project specifically is I needed data. So when you look at risk assessments, you need to do a root cause analysis and you need to understand how to mitigate that risk. The South African Cancer Registry, it was last updated in 2019. And when I started this project, it was actually 5 years out of date. So in 2014, my father, my brother-in-law, nobody was on that list when I actually started this project. So how does government and decision makers basically make decisions without having that data in front of them and actually looking at the peaks and trends and the different forms of cancer and how it actually affects the citizens of the country? My biggest thing as well is cancer doesn't just affect the individual. With us, my father was diagnosed with 6 siblings, plus his entire family, my mom's entire family. Cancer has a ripple effect. And so also one of the biggest things about it, data is it automation. Like I said, the cancer registry, for example, in this instance, is very, very manual in the sense that there's a process where your blood test goes to the cancer registry, they do all this data analysis, and it's not real time. I don't know if you need to be able to say, if you diagnose, God forbid, if you get diagnosed today, within 24 hours, your information needs to be in the cancer registry. So by the end of the month, we have a bigger view of what cancer is. And then to create new value, and that's what PACE is. We're looking to create new value using the data, and in order to change people's perception about their health and how they can basically do things differently in order to prevent cancer. And also, I'd like to just bring up some points about real-time data. Like I said, instant feedback. Because then it's constantly your user and you are constantly communicating. I mean, there's an example for there's certain people. I was at a national cancer march last year, and some people are waiting 18 months just to get a screening at a national government center. Now, to me, that's unacceptable. It's online. It's cross-functional. So you literally, one of the examples I'd like to share is a patient who's gone from, for example, private care to public care. He had to do all of her screenings once again at government level versus just taking that information from private sector to government, saving costs, saving time, and actually giving her the treatment that she wanted. And that brings me to another point, which is it's data driven. And so data is literally the future. Data is going to be the next crude oil of the world. And big data is something that I think everybody wants to see. It's intelligent. Artificial intelligence is also playing a huge part in terms of this and automation of those systems. And it's going to continuously improve. Now, I have an ISO 9001 background. So if you look at it, it's it's like a cyclone. So you start at one point and you constantly move up. So you're growing and you're using your customer focus and you're using your customer feedback to literally grow. So that's with regards to customer and what is digital. Digital transformation, I think the best example I could use for digital transformation is COVID. I think we were all put into the thick of it at digital transformation in terms of how our groceries were delivered, how we worked, how we connected with people. COVID literally has transformed the way technology has been used in our everyday lives. And I'd like to just, people need to, for example, there's 27 people on the call when we started this, right? Every one of us is using a form of digital intervention as part of our daily lives. And how we actually use that digital innovation to better our lives. And that's the purpose of this. It's innovation. Um, One of the most interesting stats that I could find was the rise of digital health. So just in the space of 3 weeks, that was 15 times. So they went from 100,000 users on the 16th of March to 1.5 million users by the 6th of April. So that just shows people were scared to leave their homes. People were scared to buy groceries. And this pandemic has also brought cancer to a different light, because cancer patients' lives were actually tremendously affected by COVID because they couldn't go to their oncology visits. Some oncology visits were closed down during this time. They couldn't actually get the continuum of care that we are trying to hopefully provide to the cancer ecosystem. The digital health market is going to boom, and it is something that I couldn't find South African or African-based stats, unfortunately, for this presentation, but it's going to grow to 295 billion. Now, if you even convert that to rands, it's just it's a baffling number. But I need people to understand that digital health is related to telehealth. So when you can actually get a doctor on the other line, on the other side of your phone, so you can see them, describe your symptoms and so forth, and then they give you a prescription and so forth. mHealth is a mobile health solution. So you're basically taking, I think the easiest way to explain mHealth is, I'm going to use the Internet of Things, right? So if we look at wearables, so my mom was diabetic, for example, and she needed to constantly take her blood sugar levels. Now her system was manual, so she literally had to do everything by herself versus getting a digital wearable device that literally speaks to an app. And this app will then able to track your cycles, give you graphs, say when your blood sugar was high and low and so forth. So that's very interesting. And then brings us to healthcare analytics, which means that doctors are able to use your data over a wider period of time and actually come up with better treatment solutions. And then the digital health system is my passion, is looking at the full ecosystem of all the healthcare providers, or all the ecosystem members or stakeholders, and how each one of them actually play an integral part in your health journey. So this was absolutely fascinating for me. And I just think we need to understand where the future of digital is going. So Hootsuite basically does the data is on the datareport.com. I put a link in the presentation. And from the world's population, this was released in January 2022, of the world's population of 7.9 billion people, let me get my numbers right, 57% of that is urbanized, right? And of that 57%, 5.31 billion people actually have smartphones, right? And we are using our smartphones, and we're using the access to the internet as a means to make our lives easier. I have got 3 children, and when I say to them, they ask me a question, sometimes I say to them, let's Google it. And I think that's the mindset. It's like, how do we are consuming data on such a rapid platform that it's only going to grow. However, the next slide is actually very fascinating, because internet adoption from the global stats has got we've got 6 African countries on here, right? And you can see the potential for Africa itself to go digital and to provide solutions for our African people. And that's something that I think we all need to be passionate about, because we have the resources, we have the skill sets, we just need to make sure that our products get to market. Device usage, I put this in for the very fact that people need to understand that all aspects of digital, it touches every aspect of our lives. From the time just being on this call via Zoom is a digital interaction. And some of us are accessing it through our tablets, some through our phones, laptops, and so forth. But the statistics are alarming in the sense, for example, mobile phones, any mobile phone has a 92.1% usage. The internet rate, for example, the internet usage on tablets is 28.2%, but it also gives us an idea in terms of how to develop, which is a very interesting feature as we grow. And this, like smartphones, is definitely the fastest growing, although it's come down by 0.9%, but it's still going to continue to grow. So my lighting is really bad. So I just want to bring this to the fore. So digital in our lives. So the experts are basically talking about the different digital impacts that we are going to face. And I just want to go through them. So digital inequality is one of the biggest one. In the world where we had lockdown, there is a disparity between people actually getting access to resources. So we need to think about it in the sense that, for example, in South Africa, the internet usage within the rural areas is different to that of the urban cities. So there is digital divides and digital inequality, and up in Africa, as you saw, like there was 24% for one of the countries. Just to go back there, Middle Africa has got 24% versus South Africa has 66%. So there is a huge inequality in terms of access to digital information. The next one was Web3, which is something that was new to me and something that I don't think we all are aware of. But it's basically the inequality between the big monopoly or the Facebooks and the Google that have monopoly over the internet and how we actually use social media and so forth. So it's the adoption of new role players to come in, and that's where we basically sit, right? We come in with new innovative ideas and try and disrupt the world and try and bring our solutions to market. And then the third aspect about this is I think of what's the show we all watched. Sorry, it just slipped my mind, but basically it's the meta world. I think of Doctor Strange. But all of those, how do we bring the whole AR avatar kind of scenario to play? And that's something that's very fascinating. And it's going to be a fantastic market to get in because people are trying to get out of their daily lives, daily routine, and are looking for ways to change the way they perceive, they use their time. And so you'll see lots more of the digital, it's called a multiverse. That's the word. It's called a multiverse. Interactions coming through in the future. And also we can relate that to healthcare because we could use it in a way to to get a better understanding as to how the body functions. From our perspective, we could give people more insight with a little video and audio as to how cancer works in the body. There's a whole host of things that we could do going forward. I love this thing by Walt Disney. He said the way to get started is to quit talking and begin doing. And so I put a few resources in here for everybody. So Free Code Camp is one of the biggest global free online coding platforms there are. It's phenomenal. You can go in, there's thousands of hours worth of content, and you could literally design something and put it out there for people to comment. And the purpose of giving you guys all of my background is because all of those background stories basically set us up to look at what we could come up with as a solution. So my advice would be for people to look at their ecosystem, look at what the niches are within their ecosystem, find those little gaps in the market and see how you could come up with a solution, a website, an app, a digital web e-commerce site or something of that sort to actually service your market. The youth is my passion. Like I said, I've got 3 kids and they all do coding on the coding.org website. We need to start getting children used to digitalization. And I read an article recently to say that Johannesburg is going to be set up to be the Silicon Valley of Africa, right? And in addition to that, one of my biggest things is out of the 10 jobs in the world currently, I think about 5 or 6 of them are all related to digital, right? And in addition to that, they're saying over 53%, if I get my numbers right. If I don't, I apologize, but the last article I read, 53% of the jobs of the future have not yet been created. So we have to start getting our youth used to use a digital technology. And my go-to is YouTube. If I don't understand anything in anything, not just development wise, anything, I am a YouTuber. And when you guys have time, please go back to that data report that I sent, this global data report link, this one over here. Actually go and see. YouTube is literally the fastest growing medium in the world, right? So digital content, people want to consume data at their own level, at their own understanding. So it is something that we have to start looking at, and so that's why I put YouTube as a resource in this presentation. If you don't know it, YouTube it. If you want to start a business, YouTube it. And that's me just talking. And then why PACE? PACE is an amalgamation of all the history, all the experience, all of the pain points, if I can say that, of the journey of not just myself. So I've got 2 co-founders, Romana and Mohammed, and in addition to that, it's all our family members that have been through cancer and the cancer ecosystem. And so we are trying to develop a digital solution that will serve. It's customer led. Like I said, the definition of digital is customer led. It's centric, it's data driven, it's automated. And we are at this point looking for funding and sponsors and investment in order to take this product to market. And this is just not for South Africa. We intend to go up into Africa with the project, hopefully, God willing. And in summary, digital is here to stay. We are not going to get away from it. It's only going to consume our lives more and more. However, it's the way we allow it to consume our lives that will be the deciding factor. My biggest aspect about this project is health is wealth. I mean, literally, my father, my brother-in-law had all the money in the world, and we could not buy back their health, right? But if we use digital technologies and systems and tools, and that's my core, systems and tools, and how we implement those things into our everyday lives in order to make our lives long-term, more efficient, better, all of those beautiful things, hopefully we have a more productive, and I'm passionate about Africa, like wholly passionate about Africa. We can go out and show the world what we are able to develop on this continent, and yeah, just grow and succeed going forward. So with that, I thank you for your time. Thank you for joining the call. My email address is here if anybody wants to reach out. I am on LinkedIn. And yeah, if you need to give me a call, ask Bertha for my number or reach out to me on one of those addresses. Yeah, and I'm open to questions. Oh, my apologies. I just want to play something quickly before we end this. My lighting is really bad.
Story number 6 is the world spent $170 billion on mobile apps in 2021. And just for clarity, that figure only includes spending directly within app stores and doesn't include e-commerce spend or mobile ad revenues. App Annie's excellent new State of Mobile report reveals that worldwide app spend grew by almost 19% over the past year. And our additional analysis suggests that consumer spending nets out at just over $27 per smartphone. Now, that might not sound like a lot, but to put that figure in perspective, consumers now spend more money on mobile apps than all the world's brands spend on social media advertising. And what's more, that $170 billion annual spend on apps equates to 0.2% of total global GDP, highlighting just how important the app economy has become. Entering the top 5, the latest data from GWI shows that people now spend an average of almost 2.5 hours per day using social media. Over 2022 as a whole, that will add up to more than 4 trillion hours of combined human existence. Meanwhile, some more great data from App Annie reveals that YouTube accounts for the greatest share of our social media time. Android users spend an average of 23.7 hours per month using the YouTube app, compared with 19.6 hours per month for Facebook and for TikTok. However, while the time spent with Facebook and YouTube remained relatively stable over the past year, average TikTok time has jumped by 48%. TikTok.
So people are looking to consume content on their own time, at their own time, and that's the message of this. Digital is here to stay, content creation is here to stay, and yeah, I'm open to questions.
Wow. Thank you so much, Faheema. So comprehensive, and you have shown that you have done your research, and we can truly see the passion. Thank you so much. And you've highlighted very shocking statistics. I mean, I had done a little bit of research, and because of COVID, getting my, obviously, a gap being seen that there is not much data and on actually within our African countries on cancer stats in terms of patient care, cases that are coming up, and it's something that we can use digital platforms and technology to achieve. And I was looking at the leading public health service journal from March 2020, which actually stated that patients in the UK were waiting 3 months for a response because of cancer and missing cancer screenings due to the pressure from COVID-19. But you're already telling me that 18 months, and this is before COVID in South Africa, for example.
For example, yeah, there's alarming stats when I have to. There's a huge disparity between government and private care in South Africa, and so hopefully what we're trying to do is we're going to try and close that gap. I just have to share the statistic. So according to one of the reports, there's 39 cancer oncologists in government for South Africa, compared to 105 in private sector. And yet the government sector is footing the bill or responsible for over, I think only 16% of South Africans actually have medical aid. So the 84% is don't have medical aid, and that's where the 39 oncologists are sitting. So we're trying to use technology to hopefully bridge that gap.
Yes. So I think the first issue that we can discuss in terms of the impact of digitalization on cancer care is access to information, access to, what do you call them? Electronic health records have been managed to be created, moving us from large paper files, which are difficult to track. And I think our question from our audience, which came, is that how has digital innovation improved cancer care in general? And I think that's from Kenya. And I think immediately you've responded to that. It's access to information. And COVID has shown that a lot of people have actually missed cancer screenings. And this has affected a lot of people with chronic diseases. So that's definitely, and tell us the process of how you have managed to gather this data as PACE.
So it's been a real journey. So we were not able to find accurate data from government, for example, right? So when I started this process, the National Cancer Registry was my initial access point. But because my sister-in-law, for example, I just have to share this. My sister-in-law works at government level and is a ENT specialist. She's the head of her department. She's a speech and hearing audiologist. And her words to me, I'll never forget the story, was she sees cancer. So she deals with the ears, nose, and throat. So she can see oral cancer. And cancer is very specific. You can see it in the mouth, right? So she will be able to identify as the doctor that it's cancer. Then before she actually sees the patient again, they don't come back because they've passed on. The cancer has spread so prolifically that that information never actually ends up in the National Cancer Registry. So this is happening on the ground. So I then went back to the most credible data source that I could find. And there's a 2020, last year, 2021 cost of cancer burden report that was commissioned by Cancer Alliance. Sorry, I just needed to get that. And they use the very same data set, which is the Discovery Health, the medical aid company, the Discovery Health. They are the only credible data sources that we were able to find as PACE and Cancer Alliances then.
Wow. So, and that also responds to our other question, which was, how can a community-based organization digitalize community health and development of data? So that's another question that came from Kenya. How can community-based organizations digitalize community health and development of cancer? So do you think your model that you've applied at PACE is scalable and replicable to other organizations to be able to use the same approach that you've used?
I have a vision for Africa. I have a lot of the research that I've gotten is from the American Cancer Association. And I thoroughly believe that the solution is for Africans by Africans. And so that's my aim. A very, very quick solution is to start I know this is strange, but start a Google form. Send it out to all your cancer patients, for example, or the people on your cancer database. Ask them to complete it. I have a survey if people want to reach out to me. I have a survey, they can complete the survey and we can give them access. So that's a step towards digitizing their cancer records, for example. But PACE is definitely scalable, and my aim is to go up into Africa.
Okay, so my next question is from Kenya again, and I saw another question from similar to this one from the chat group, and it says scalability of digital innovation in rural areas. And I think I'll pick up the question from the chat, which says, just to add, could we say digitalization is only for urban zones, or how possible is it and to push this to the rural areas?
So it's actually been one of my biggest gray areas, and the one thing that has kept me up at night. So my suggestion would be to use, I need to get my terminology right. You know, the *12325 hash.
USSD platforms.
USSD, thank you. Sorry, thank you. That's the one, USSD platforms. That's the easiest way to get there, because when it comes to rural areas, we're seeing that a lot of people actually don't have smartphones. But with the USSD, one of the organizations I've talked with through this journey has been Mom Connect, and that's a government-run mother-child platform. And they actually said to me the USSD platform is the easiest way. People can say diagnosed with cancer. I just have to share one of my biggest, honestly, I literally have sleepless nights about this, is sharing the story about a gogo, so one of the people in the rural areas that literally walked through rivers and ravines just to catch a taxi to go to an oncology center that was like over 50 kilometers away. And these people literally have chemo and radiation. And if you have chemo and radiation, you are in a state you're physically not able to function. So the aim of this is to use USSD and find beautiful sponsors that will help us, get those people into hospices, into organizations where they can get the treatment for the time they need, and then they can go back home.
Oh, thank you. Another question, thank you so much. This is from Abdul. Abdul says, great presentation, Faheema. I loved all the things you said. But I would like to understand, I think, and this also links to the question that has just come in from Constance. I'd like to understand the challenges faced in the process of digital transformation. What about implementing digital transformation versus education, citizen education level? How the cost and accessibility to internet can affect. So I'll also just read Constance's question. How will uneducated people make use of this app? Old age people, for example, and the physically challenged. So I think to combine those two questions is the capacity of the citizen in terms of age, in terms of physical challenges and education levels, being able to tap into this platform, which is supposed to help them. Maybe we'll start with that one before we go to internet connectivity.
Okay, so so we have thought about it in two ways. So South Africa has got 11 official languages. Let me get my number. 11 official languages. So what we thought about is literally doing like the introductory videos into cancer in 2 or 3 of the 11 official languages, just to get people to understand it. One of the people said to me, I could use Google Translate, but I'm very wary about that at this point because of the dialect, and the direct translation doesn't make sense sometimes. So we have looked at it. The other things we're looking to do is to do activations. I think I'm going to be we want to create a presence. We want to say to people that this is for you. So we are going to go out there and we are going to market this. And if people have any questions, we will cross that border when we get there.
Great. Maybe I think we've also touched on a lot of the next question is from Ellie. And what are the challenges of digital healthcare, mainly in the African context? And one I would immediately highlight is obviously access to internet, which Abdul had mentioned, access to internet and infrastructure in the facilities, the health facilities, to be able to implement and actually these be able to install these apps and softwares that are required. We're also talking about the skill required. Do we have capacity? What recommendations could you give, or what have you faced with the institutions that you've possibly worked with?
So we have had pushback with regards to digitization of, for example, the clinics. So what we're trying to do is, long term, we will have kiosks at the clinics where people can go into the clinic and then access the platform through the clinic, right, at the clinic. But we're trying to get, for example, one of the features is going to be where the sisters in the clinics literally are able to communicate via the platform to oncologists, for example, and get the information and the support they need. Because like I said, some of the sisters are not trained, like Dr. Lydia Crosschild, if I remember her name correctly, is one of the leading, she works for she's the head of oncologist at Grooteskier in Cape Town, and she talked about the faces of cancer, right? And it's the most beautiful thing because she talks about the inequality. It's about the lady that's waited 6 months just to get a follow-up consult with a doctor. She talks about the cost of cancer in terms of money and disparity between like different people. And so what I've done is I've looked at all the 5 faces of cancer, and I've tried to answer those questions as we've built PACE. I don't know if I've answered the question, but literally we are trying to get as much feedback from people on the ground, and we're saying, what can we do differently in order to make this platform? Because my aim of this platform is to make sure that it is customer centric. We've spent years building this concept, and now we're ready to take it to the next level.
Okay, I think, and the issues you've highlighted lead me to one of the benefits of our discussion today on the impact of digitalization on healthcare, and particularly to cancer, where telemedicine and telehealth have greatly risen. You shared some statistics of how the future of digitalization on healthcare, and it has helped in terms of it's cost effective, and also it has helped to determine who needs emergency assistance. And what is your comment on that? How have you seen that actually come to play?
So it's interesting that you say that, because we haven't actually seen it come to play. I think people are just so resistant. The South African mindset, and I've heard the stories where the older generation thinks it's black magic or one of the other things, and they don't believe it to be cancer. So they will wait it out until the last, until once somebody like really takes them to the doctor and goes and actually gets a screening. But it's scary what's going on the ground. But my thing is, if we don't start planting seeds right now, and that's what PACE is. PACE is a seed of change and transformation in terms of dealing with cancer is a pandemic. There's no doubt about it. I just have to share. There is no South African statistics. The last South African statistics, or I should say no current South African statistics, the last South African statistics I was able to get my hand on was from the National Cancer Registry, South African National Cancer Association. And their stat was 1 in 6 men and 1 in 7 women would be diagnosed with cancer, right? So of the 37 of us on the call, we split that in half, 15, so 2 people, 2 male and 2 female would be diagnosed with cancer. And that's horrific in itself. And sitting here, my biggest aim is I will turn cartwheels, stand on my head. I've done so much international research. Cancer is preventable. Cancer is only 15% hereditary, and still too, it is preventable. And I'm saying to people, through active daily interventions. And out of there's an international study, out of 100 patients, 94% of all the patients had a traumatic experience through their life. So I just want to say this to everybody: cancer is related to emotional wellness. And so when we're not dealing with the root causes of these diseases, they manifest themselves. So my aim is to educate, literally.
Wow, thank you so much. So my next question, actually, it's a question from Kenya and a question from Zimbabwe, and it's all about the Kenyan, how do I stabilize my business to be self-sustainable, and how can ICT make me money? So I want to combine those 2 questions and ask you, Faheema. We've had someone ask us how they can replicate this in their community. And how do we make money? How do we make sustainable? How is your business model being able to make enough revenue to be sustainable?
No, 100%. So firstly, PACE has been self-financed. So it's literally just us coming together and just financing this project to date, right? Because we believe in it. And so going forth, through E4Impact, our coach literally said to us, you need to make money. Because that was personally my last aim, right? Personally, I have to just share that. But in order to make this sustainable, we have to look at how we're going to generate revenue. So we've got 7 different revenue models within the PACE platform right now. And so you need to look at what people are going to pay for example, right? So if you look at some of the international courses I've done is on health and cancer specific. So let me give you guys the truth about cancer. The truth about cancer is a global cancer movement, right? So they basically make cancer videos, and they have got newsletters and so forth, and they actually sell products and stuff through their website in order to generate revenue. So you need to think about how your product is actually going to add value. And I swear, Bertha, I'll say this again, E4Impact literally made us look at revenue models and how we use our pains and gains and identify how people, what people would be willing to pay for. So it's something that you need to sit down. YouTube business model canvas, I guarantee you that is something that is going to make a difference in your business. Speak to your customers was also something that came up through the course. So ask them directly, What are you willing to pay for? Find your niche, and be vocal. I mean, put yourself out there. One of the biggest things I think for myself, and that's why this is the first time I'm actually talking about pace outside of my intimate circle and the business meetings I've had, was the fear of people not buying into it. And so once you put yourself out there and actually identify your worth and what your concept is worth, you go out there and put it out there and speak to as many people as possible. And then with regards to sorry, Bertha, with just regards to how ICT makes you money, I nearly fell off my chair when I was doing costing for E4Impact, when they said to me, a developer, just a developer, like a senior developer, owns over 85,000 Rand a month. So you're looking at R1 million a year salary. So like I said, start your children young, start them on coding, get them into the development industry, and upskill yourself, because there's lots of money to make. I mean, some of the digital innovations are still coming, so there's lots of opportunity out there.
Yes, definitely. 4IR is the way forward. We've got the technologies and softwares of the future. Take note of those and prepare the right skills for the future. The next question that I have, very important questions. We are left with only a few minutes, Faheema, but let's talk about cyber risk. Let's talk about privacy of patient risk, high risk in patients receiving wrong treatment, referring to platforms like telemedicine. What have you experienced in terms of this? David is asking this.
So cyber risk is real. My suggestion is to literally, my vision is for people to become their own doctors. I say this, and I'll say this publicly, it will be published. A doctor's rooms is called a practice for a reason, right? They don't know exactly what is wrong with you. You need to become your own doctor, right? We need to educate people to understand the very, very basics of what their bodies need. And when something is wrong, you need to automatically to be able to say something is wrong, right? And then keep a journal. So interesting enough, with regards to, let me get first, I'll go down the rabbit hole because I'm so passionate about advocacy and health advocacy. But with regards to cyber health, it's been one of my biggest, like I said, I'm a risk person first. So when I think about hacking and data security and all of those things, we have made sure we've built all of the latest technology into place. We will be audited. We will follow protocol, right? But when it comes to there's nothing we can do. It's unfortunate. In South Africa, one of the financial institutions were hacked. There's nothing, there's going to be evil people in the world that's going to come in, mess up something. They will hack just for monetary gain, but there's nothing we can do to protect it. But what my message to you is, if you are using a digital intervention, make sure that it's your records, make sure that you have a list of your own records. Don't just rely on the medical professionals, but you need to take responsibility and ownership for your own health.
I was just reading an article just before this where it is actually encouraged now, because of digitalization and access and availability of information online, you have an informed client. So that means you have you as a patient have a right to actually do your own research. And you find that the article I was reading is advocating for an MDT approach where clinicians and patients work together to make decisions about tests, treatments, the follow-up process. And it's a two-way dialogue now, because which leads to coordinated continuous care of the patient. So a collaborative approach between the patients and the clinicians themselves to be able to give high quality care for and a person-centered approach to cancer care. So, our time has run out, and yeah, go ahead. Your comment on that.
I just have to share this. So I was on it's a global FDA, so it's the American Medical Association, the Drug Association, the Federal Drug Association, the FDA. And they had a gentleman on that said just that, Bertha. He said what was happening in the past is that oncologists was prescribing these drugs because these drugs worked, and according to them it worked. However, the patient was not reacting to that dose of treatment, and so the doctor had to adjust it or change the drugs. But it's up to the patient as well to say, and one of the patients actually did, she said she doesn't want this drug, she wanted something else, and she's still alive. But you understand, it's we as the end user need to say to the doctors, this is my right and I'm taking back ownership. And that's what PACE is standing for.
Wow. Thank you so much, Faheema, for your quest to keep pushing to give information, give us information about improving the quality. I loved what you said, that the source of maybe some of these cancers is the quality of life and improving our mental and physical health. And that is what prevents us from getting cancer. So I just want to thank you, and I wish you all the best. And I do pray that more institutions come on board, and the resistance, we work harder to appreciate that this is the way to go, and this is the way to improve. I mean, digital care is becoming, technology has become an integral part of healthcare, and is revolutionizing medicine. And the healthcare professionals and the patients themselves have been transformed in their approach to this. So just to summarize for me, we talked about data, medical information. And for me, one of the benefits is we've really realized that digital platforms technology allows us to give access to healthcare, to patients, screenings to continue online through telemedicine, especially through COVID. We've actually seen that collection of big data has allowed research to continue, and you see even the people were shocked, how can vaccinations come out so fast for COVID? But it's because of big data. We have access to information, analysis, evaluation of of information is now faster thanks to technology, and improved lines of communication. We've seen digital care bring across communication between health providers, patients, and all key stakeholders. Real-time information through the electronic healthcare records, and also development of skills. I mean, yourself, Faheema, you've shared how much you've gone online. Our course which you did was online. So online education is one of the benefits that has digital technology has come through and helped us. And of course, the apps which you've described, where you've talked about, you said your sister, your mother had to do everything manually to test herself, but now you have the app which is connected to a gadget which you can put on yourself, and your sugar levels, everything is tested. So I just want to thank you, Faheema, for this work that you're doing, and we continue to pray for more people like yourself who care about such causes. And just to thank our audience which came on board today. Thank you, Faheema. If I give you last word to say bye.
No, thank you so much, Bertha, for the opportunity, and thank you to everybody. Like I said, I left my details, so please, if anybody wants to reach out, it just takes one person, doing the right thing, and hopefully we have a knock-on effect, so it becomes an ecosystem long term.
Yes, thank you so much. And just a prayer to all those who have lost someone. I have a dear friend who has lost a sister recently, and we thank people like yourself who care about this issue and who continue to give comfort to families and communities who are going through this very difficult experience with cancer. Thank you, everyone. Please stay safe and have a good evening or good afternoon wherever you are. Thank you so much for joining us. We'll catch you next time. Like I said, our social media platforms with this will be on our YouTube channel. You talked about YouTube. We have a YouTube channel, E4Impact YouTube channel. You can catch up and catch more information. And I wish you all the best in your endeavors, and good health to everyone. Bye-bye.